Welcome to the Barton Joint Replacement Pre-Surgical class. Thank you for taking the time to attend. I'm Madonna Doyle and I'm the nurse navigator that'll be here to help you through your navigation of getting your joint replacement. I've been a nurse for about 40 years and I've been an orthopedic nurse here at Barton for 20 years. So if you have any questions, don't hesitate to contact me by either calling with my telephone number that you already probably have, or you can email me as well. I'll be here to help you before surgery. I will see you while you're in the hospital, and I will be available for you for questions after surgery as well. And again, thank you for taking the time to watch the video. They have found that those patients that are educated about the surgery beforehand tend to have better outcomes, and that's what we want for you. So today we're going to go over some general information, how to prepare for the surgery, understanding your surgery, hospital expectations, your rehabilitation, and your recovery at home. So our goal is to get you back to the activities and lifestyle that you're used to as quickly, but also as safely as possible. Safety is a big issue. This is elective surgery and we want you to have good outcomes. So when you need to ask for help, that's perfectly okay. I did want to let you know that we are Joint Commission certified. The little emblem on the left, Joint Commission have come out to certify us. We've always had great surgeons here in South Lake Tahoe, and that symbol signifies that we also are using best practices for the nursing care in your hospital stay and your rehabilitation. So it is important to have someone at home with you. You will be able to get up and walk right after surgery, but it's good to have someone there to help you. You will actually be able to get up and walk within a few hours of surgery, and when you're at home, you'll be able to get up, get a glass of water, make a peanut butter and jelly sandwich, but just to have someone there to assist you is a good idea for about 3 to 5 days after surgery. So there's no test at the end of the class, but you do have some homework. After watching the video, I want you to go out, look in your house and see what changes you might need to make to prepare you for the surgery. So it's good to have like a little recreational area where you can have some activities that you can do. You will be up walking around, but maybe not as much as what you normally would be doing. Have some books, puzzles or something that you can do. You want to make sure the electricity cords are all out of the way, that you don't have any throw rugs. And then with the chair that you will be sitting on for your hip, for a posterior hip, which some of the doctors do, you need to make sure that you have a chair that you're at L shape and a little bit more. So just a little bit more than 90 degrees that you can kind of lean back on. It's very important for getting out of the chair, this kind of seat. So it's more for posterior hips because you don't want to be bending forward, or you could dislocate your hip. For the anterior hip, you just want to have a chair that's easy to get out of. And then for your knee replacement, you want to have a chair that's at L shape that you can do your leg exercises that they'll be giving you. You don't want to be too low on your chair because it's too hard to do your exercises, or you don't want to be too high in the chair. Otherwise, it's going to be too hard to do your exercise. So just think about a chair that would be good. So going back to your house, if you have a dog, they're going to miss you while you're in the hospital. So you'll want to, when you arrive and you're still in the car, have the family members put the dog in the other room. You come in the house, get settled, put a blanket over you, and then have the dog come in to see you. You just don't want the dog jumping all over your dressing or anything. You don't want any cat toys or anything on the ground that you might trip over. And then if you have stairs to go to your bedroom, you want to make sure that you have some kind of rail or if they're very difficult stairs, you want to make sure that you have a bed downstairs that you can sleep on for a few days. Again, you will be able to do stairs before you get discharged from the hospital, but sometimes, it might just be a little bit difficult, so you'll want to have someone there to help you with that. With the stairs, just remember that at nighttime you're going to be most tired, so you don't want to wait till the last minute to go up to your room. You want to make sure that a couple of hours before bedtime you make your way up to your bedroom. And then in the morning you're going to be most stiff because you've been laying still, you haven't been creating motion in that joint, and so it's going to be stiff and a bit more difficult to do the stairs. So get up, move around upstairs, and then maybe an hour or so later come on downstairs. So with your shower, if you have a walk-in shower, you can put some kind of stool in the shower stall. You can also get an elevated toilet seat like this. You can get them from the attic, or you can get them online, and you can put that in your shower to sit in. If you have a tub and it's really hard to get in, it might be better to do a sponge bath for a few days and then work out what the best way would do that. Or you can buy this bed, this bench that can go over the tub, one leg in and one leg out. And if you have any questions about your bathroom when you go home, you can definitely ask us in the hospital, or you can contact me before surgery to ask the questions. So definitely, if you're having a hip replacement, you want to get this elevated toilet seat. You can get the elevated toilet seat with the legs that sits over your toilet. That can also go by your bed at night if you need to. Or you can just get the elevated toilet seat that goes up about 6 inches and has handles on it. But you want to make sure that you've got something that you can grip hold of to get up when you are getting off of the toilet. So you want to make sure that you have non-slip mats, rubber-backed mats, definitely some kind of anti-slip device in the tub there. And then if you can have rails put on, then that's definitely a good option as well. So then I want to talk about the dressing. So I'm going to sit down over here. And for the knee replacement, you're going to have a dressing like this. This is a silver impregnated occlusive dressing. The silver impregnation has some antibacterial properties that help to prevent infection. The occlusiveness of the dressing also helps to prevent infection. You will have this dressing on for about 5 to 10 days. After you see the doctor, then there will probably be no dressing on the wound, and then you can just shower normally. But until the dressing comes off, you want to put cling film, saran wrap around this, and then you can get in the shower. Once you go to see the doctor, then again the dressing will come off and you'll be able to shower normally. So with the hip, it's the same thing. You'll have either a dressing here for the anterior hip. You want to cover that if you can, and just make sure that no water gets into the dressing. If you do have to shower and it is time to change your dressing, the dressing's changed about every 5 to 7 days. So your caregiver will wash their hands, sing happy birthday all the way through, and then you'll open up your clean dressing, and then they'll take the dirty dressing off and discard it in the waste bag. And then you'll wash your hands again, sing happy birthday all the way through, and then you'll put the new dressing on. Stick it down. These dressings are designed that you can lift them up if you need to. And so if you, when you put your knee dressing on, it's usually at about this angle, but if it's bent like this and when you stand up, it's too crinkly, you can just lift the dressing up, move your leg out, and then it's just fine. And you'll notice that this dressing is a different color. It's because this is not silver impregnated, but it's still an occlusive dressing. And then again, once you go to see the doctor, then we tend not to have the dressing on after that. And again, if you have any questions, then you can just ask me in the hospital. If you do, a few people do have home health come to their house and they can help with changing the dressing, but most people these days are going to outpatient physical therapy, and I can give you another dressing that you can change it at home. So it'll be your caregiver that will change that for you. So you've decided to have surgery. I call you and get information from you. And then the pre-op office, they will also be calling you. They get your medical surgical history, and they will be giving that to the anesthesiologist. And they will look at your medical and surgical history and decide what testing that you need to have before you go to surgery. Some people just need to have a blood test. Others might need to do an EKG or an X-ray or even a stress test. But it all depends on what your medical and surgical history is. Most people will need to have a primary care provider appointment, and so it's important that you get an appointment with your primary care physician. So that we can help to coordinate with our pre-op office to get you in the best possible health. The old days we called it cleared for surgery. Now we just want you to be in your best possible health so that you'll have good outcomes. Some people do need to see cardiologists or other specialists, and that will depend on your medical surgical history. So the pre-op office, they'll be telling you things that you need to stop before surgery. I'll also be sending you some texts and emails that will help to keep you on track. So you will get an alert as a text 2 weeks before surgery that'll say, stop your vitamins, your minerals, especially your fish oil and vitamin E, herbal and nutritional supplements. This does include herbal teas because there's no regulation on those kind of things. And the main reason for stopping this is we don't want you to have things that will thin your blood. Most of those things have some blood thinning properties, and we don't want to have that right before surgery. So you'll have to stop those things 2 weeks before. 1 week prior, usually you will need to stop aspirin, Motrin, ibuprofen. If you're on a blood thinner, it'll be a coordination with your primary care physician, cardiologist, and the anesthesiology department of which medications that you will need to stop that week before. And again, you'll be getting the text that will remind you when that time is. So I was talking about being optimized. We want you to be in your best possible health for this surgery. This is an elective surgery, and we want you to have the best possible outcomes because being in your best possible health will lessen your chance of complications and shorten your recovery time. So definitely stopping smoking is one of the important things that you can do because it makes your blood vessels shrink and it delays healing and slows recovery. If you get an infection in your joint, it's just not like getting an infection in your arm. There is no blood vessels that go to the actual prosthesis that they put in, and so you want to make sure that you don't get a wound infection. So stopping smoking, no drinking, alcohol 2 days before is a good idea. Eating nutritious meals before surgery is important, and then staying well hydrated. The week before surgery, you want to really take that time to yourself, that you will be relaxed, that you will try to reduce your anxiety. I know that you'll be worried about your surgery, but just doing some deep breathing and and staying positive is going to be very important. And then making sure that you're getting your 8 glasses of water a day. I suggest starting them first thing in the morning so that you can get your 8 glasses in during the day, and then kind of wean off in the evening so you're not all up all night going to the bathroom, because you want to make sure you also get good sleep. So infection. I talked about that before. One of the other things that you can do to help prevent infection is these 3 showers before surgery. What they found is a minimum of 3 showers before surgery will block the growth of the organisms for the best protection. So everyone will be receiving one of these shower kits. You will have either gotten it or you will get one from your doctor's office, or contact me and I can help you. There's a hand sanitizer in most of them. You can use that for after surgery to prevent infection. The chlorhexidine wash, a nail brush. Included in your shower kit directions. So it'll be 2 nights before, the night before your surgery, and the morning of your surgery. It has all the instructions here. On the back is also other ways that you can help prevent infection. And so it's a good idea to definitely have a read of that information. So, this is the chlorhexidine. You're going to use this 3 times. So we're 2 nights before surgery. You shower normally. You can wash your hair. But everything that you do is going to be from your neck down. So you get a clean, wet washcloth. You put 1/3 of the solution on your washcloth after you've already showered. And then you turn the water off, because you can't lather while the water's running. Then you want to lather your surgery site, whether it be your knee or your hip. And then you lather the rest of your body up to your jawline. You wait 1 minute, it creates a film on your skin, and then you're going to turn the water back on, and then you're going to rinse off really well. It can be drying, but it's only for 2 days. So you're going to dry with a clean towel, no lotions, potions, or deodorant. You're going to put on clean pajamas, and you're going to have clean sheets at least the first night. And then it should say no pets on the bed. That is the CDC recommendations. I know pets are part of the family, but you just want to make sure that they're not under the sheets. And then there's no shaving 1 to 2 days before you do have your surgery. So you do not need to shave. But if you do shave, like your underarms or your legs normally, you want to make sure that you don't shave for 2 days before you start your showers. Okay, so we're up to getting ready and packing for the hospital. So we do recommend that you bring in your own walker. This is a front wheel walker. It has the wheels at the front. Most patients are only going to be in the hospital for 1 day, and so the delivery usually doesn't come until the afternoon, and so your discharge could be delayed. So we want you to get home to your own environment as soon as possible. So we recommend you getting these, usually at a thrift store. They're about $5. If you really can't get one, we will lend you one. We don't want brakes, we don't want seats, we don't want anything like that, just with the front wheels. So you have your family member bring that to the hospital room after your surgery. And that way you can use it in the hospital. Physical therapy can check and make sure that it's in good working condition. So that is a front wheel walker. If you're from out of town and you need to come and stay at a motel the night before, you want to make sure that you also bring your shower kit with you so that you can do your 2 showers at home. If you forget to bring the shower kit, please contact me and I can let you know what you need to purchase. You can bring eyeglasses. You don't want to wear contact lenses when you're in the hospital. You can bring any electrical equipment that you want to. Make sure you bring the chargers, especially for your phones, and definitely write your name and your telephone number on the charger in case you leave it behind, then we can be in contact with you. You can bring books and magazines. We want you to bring some loose-fitting clothes so that you can get changed into your regular clothes, obviously, before you go home. We'll be able to have occupational therapists work with you, and they'll give you some tips for putting your clothes on and things like that. So after your knee surgery, you're going to have the dressing, and then you'll also have the ACE wrap on it as well. There'll be an ACE wrap on your knee. And what we like to do is take that ACE wrap off before you go home. And so again, you'll just be going home with your regular dressing. So just a couple of tips for getting pants on and things like that. But the occupational therapist will go over them with you when you go home. So this is my surgery leg. So it's always going to be better to put the pants on that leg first, and then you'll be able to put the legs in the other one and then get up. And then when you're taking them off, again, the more mobile leg comes out first, and then you'll take it off over the surgery leg. And then we want you to bring some loose-fitting shoes, or some shoes that you're going to wear home. So no high heel shoes. You may have a little bit of a limp now before surgery, and the doctor's going to try and put them both at the same length after surgery. And so you may need to adjust the way you walk. So we want you to be able to walk in shoes that are easy for you to walk in. And I say some loose-fitting shoes because it is normal for the first couple of days to retain a little bit of fluid after surgery. And patients tell me it's usually the third night that they are often up peeing a little bit, and then that fluid will come off within that couple of days. So that's just a little tip there. So don't bring any jewelry, don't bring any of your medications, and don't bring any money. In one of the texts that you'll get, it'll talk about don't bring your wallet. And I've had people come with just their driver's license and credit card, just free. Like if you have to bring your wallet with your insurance card and your driver's license, just don't bring any excessive money, and make sure you just only have the few cards that you need in there. So if there's any change in your condition between now and the time of surgery, you want to let your surgeon know. You'll contact the doctor's office and let them know, I've got the flu, I've got laryngitis, I put a big gash up my leg, or anything like that that may change your ability to have the surgery. Just call the doctor's office and let them know. But the night before, if you have any problems, like you have a fever, you have diarrhea, you just you got a cold or something like that, just call the main hospital number, Barton's number, and you just ask for the head nurse, the supervisor, and you just let them know what the situation will, and they will direct you of what to do at that particular time. Okay, so the night before surgery, you want to go to bed early. There'll be nothing to eat after midnight. And then when you wake up, you will have done your shower, you go to bed, nothing to eat after midnight. And then when you wake up in the morning, it's something a little bit different. You can have clear liquids up to 2 hours prior to your arrival to the hospital. We also recommend that you have 16 ounces of either blue or white Gatorade. There's about 16 different colors of blue, and so that'll be a half of this bottle. It's 32 ounce, you'll be taking 16 ounces. You'll also get a text the day before that will remind you of that. If you have diabetes, then you will be taking the G2. So again, blue or white, 16 ounces is the recommendation. I know some people say they don't like the Gatorade, but it has shown to help decrease nausea and vomiting and improve wound healing due to the insulin sensitivity and resistance. So take any medication that you're instructed to take, brush your teeth, rinse and spit, and then obviously no smoking or drinking at least one day before surgery. With the brushing of the teeth, there was a study that came out that showed that those patients that brush their teeth 4 times a day while they're in the hospital have a decreased risk of hospital-acquired pneumonia. So while you're in the hospital, we're going to recommend that after each meal and before you go to bed, that you actually brush your teeth. We provide a little care kit that will be given to every patient. It does have a toothbrush and a toothpaste. Toothbrush only lasts 2 days, so you definitely need to go home after that. Or you can bring your own toothbrush. In your little care kit, you'll have some tissues. There'll be some hand sanitizer. You'll also have some earbuds to help you sleep at night. And then we have these wonderful eye masks that may help you to sleep while you're in the hospital. So with the brushing of the teeth, we are going to give you some pain medications sometimes that are going to suppress your drive to breathe. You're going to be laying in bed or crunched over, and you're in a hospital, and so it's really easy to get hospital-acquired pneumonia. So that one simple thing that you and your caregiver can do to help decrease your risk of pneumonia while you're in the hospital. They won't tell you the time of the surgery until the day before. The pre-op office will call you and let you know what time. Just pretend they said you have to be there at 6. So you would need to wake up just before 4 o'clock in the morning. You would get up, you would drink your clear liquids, you'd have your 16 ounces of Gatorade, you'd go and do your shower, you would pack your bags, and then you would drive to the hospital. If you live further away, you might need to get up a little bit earlier. And then don't wear any contact lenses, just bring your glasses. So beautiful Barton Hospital in the springtime. You will drive in, someone will drive you in, you'll go in the main entrance, they can then park the car, and then you'll go check in at the surgical check-in desk at the front lobby. The surgical desk representative will activate your account. They'll place the identification band on your wrist, and they take just you back to the ambulatory surgery area. Once you get all organized there, then they will bring your family members to see you before you go into surgery. So in there, they'll introduce you to the staff, put you height and weight. They'll change you into the surgical gown, and then they'll give you a little pre-op cocktail of medication. This medication helps to prevent your pain while you're in the surgery, and what they found is by giving you that medication, when you wake up, you will have less pain, and that's really been helpful. And when you have less pain after surgery, it's not triggering all the pathways in your brain, and so throughout your recovery, you will indeed have less pain. And we have some patients that really just go home on Tylenol, so it's been very helpful. We will also, of course, give you a prescription for some medication, but just to let you know, that pre-op cocktail, that's what that helps with. And then they'll be beginning the confirmation of your identity, your surgery, and the surgery site. So before every medication, while you're in the hospital, they will be asking you your name and your date of birth before every medication. And about 10 people will be asking you what surgery and surgical site will be operated on. Of course, we know what that is, but it is just a safety check for your safety. They'll get you ready for surgery. They'll also ask you medical and surgical history again. And to let you know, after surgery, when you go up to the orthopedic floor, they will also be asking you that medical and surgical history. So you get a chance to meet the anesthesiologist, and they'll explain how the anesthesia works. You will get a medication that will help you to relax, and you'll be getting 2 antibiotics there in surgery. So for the knee replacement, you will be getting mostly an adductor block, and that's going to be an injection of medication, local anesthetic, in the top part of your knee, and then that will numb the top part of your knee. You'll also probably be getting a spinal with some local anesthetic, and then they'll give you some medication to put you in La La Land or in a sleepy medication. And then if you're getting your hip replaced, you often have a general anesthetic, but occasionally you might have a spinal anesthetic as well. And then I've got up there that patients will get joint juice. So joint juice is a mixture of medications that we injected into your joint after surgery. So either into your knee or into your hip. And it's a mixture of morphine, Toradol, local anesthetic, and epinephrine. So that helps to control your pain after surgery as well. Most of these things, the adductor block, the spinal, the joint juice, usually all last about 8 to 12 hours. And so after that, then you might start to get some pain, and then we'll be talking about that in a little bit. So you'll get a chance to meet your surgery team. So then I have some information here about the knee replacement. You can see on the left is a knee that is bone on bone, and then after surgery, this is what the x-ray looks like. There's a plastic spacer in the bottom here, and then in the front with your kneecap, there's going to be a little button that goes over the cap, and you'll see that in the video that I'm going to show.
To begin the surgery, your doctor will make an incision on the front of your knee, cutting through the tissue surrounding the muscles and bone. The kneecap, or patella, is rotated to the outside of the knee to help your doctor see the area where the implant will be placed. With the end of the thigh bone, or femur, now exposed, your doctor will use special cutting instruments to measure and make precise cuts of the bone. The end of the femur is cut into a shape that matches the corresponding surface of the metal femoral component. This component is then attached to the prepared end of the femur. Next, the shin bone, or tibia, is prepared with a flat cut on the top. The exposed end of the bone is sized to fit the metal and plastic tibial components. The metal component is then inserted into the bone. A plastic insert, or bearing surface, is then snapped into the tibial component. The femoral component will slide on this plastic as you bend your knee. If needed, the kneecap, or patella, is also cut flat and fitted with a plastic patellar component. Your surgeon may choose to use cement to help fix the implants on your bone. Your doctor will conduct several tests during the surgery to ensure the correct sized components are used to help you regain good balance and motion in your knee. Your doctor will rinse out the debris from your knee with sterile fluid and then close the wound in layers with stitches and/or staples. A plastic drain may be placed in your knee to remove blood from the inside of the joint that can accumulate after surgery. The plastic drain will eventually be removed. When you awaken from surgery, you will be in the recovery room.
And then here we have an x-ray of a hip. There should be a space in there around the ball and in the joint. And then you can see the new hip with the cup and the ball fitting in, going into the femur.
To begin the surgery, your physician will make an incision in the skin over your hip joint, cutting through the skin, soft tissue, and muscle to access the hip. Once the hip is reached, the ball is dislocated from the socket and removed from the end of the femur with a saw. The socket, or acetabulum, is exposed. After measuring the size of the socket to guide accurate selection, the appropriate reamer, a cheese grater type device, is used to create a perfect hemispherical bone socket that matches the external shape of the acetabular cup. The cup is carefully positioned in the bony socket. This cup is held in place using a number of methods depending upon surgeon preference and your bone quality. These methods may include bone cement to hold the cup in place. Most cups are designed to allow bone to grow into the metal surface to hold the cup in place. These cups have a roughened or specially prepared surface, which is designed to allow ingrowth of bone into the metal itself. This type of fixation may be augmented by screws to help fix the cup in place while bone growth takes place. The inside of the femur, or thigh bone, is then cleared with various types of devices, and a prosthesis is placed into the femur. A trial ball is placed on the top of the femoral stem, and a plastic insert is placed into the cup. The hip joint is then articulated by placing the ball in the artificial socket. The hip is evaluated for the type and amount of motion it has and the stability of the joint. That is, the inability of the ball to dislocate from the socket easily. Once the appropriate combination has been found, the ball is then placed onto the femoral stem and the final insert is placed into the cup. The leg is evaluated again for stability and mobility and leg length equality. Throughout the operation, numerous measurements and operative considerations are taken to equalize leg lengths. However, the primary goal is to achieve a stable, non-dislocating hip. Prior to final assembly of the total hip, leg lengths are again evaluated. The new implants will replicate your hip joint. Your physician will rinse out debris from the hip joint with sterile fluid and then close the wound in layers with stitches and/or staples. A plastic drain may be placed in your hip and removed later. The purpose of the drain is to remove blood from the inside of the joint and tissues that might accumulate in the area after surgery. When you awaken from surgery, you will be in the recovery room.
Then you're going to wake up in the post-anesthetic care unit, and these are things that you will have. You'll have the oxygen mask on your face, you'll have the blood pressure cuff on your arm, you have the little ET pulse oximetry thing on your finger, you'll have an IV in your arm, you'll have the surgical dressing that I explained before. If you had a hip replacement, you probably won't have a catheter in, but you will have a drain in that will be taken out the next day before you go home. It's a small drain. The canister is about this size. And if you, and then you may or may not have a catheter in your bladder. But you will have these things on your legs. So these are called sequential compression devices, and they will be on like this. They'll be attached to a machine at the end of the bed, and they need to pump to work. So the only thing you need to remember is they need to be on both legs, they need to be pumping to be working, and you only wear them while you're in the hospital and while you're in bed. They help prevent blood clots. Blood clots is another complication after these surgeries, but we do a variety of things that I'll talk about later, and the chance of getting a blood clot is very minute. So you'll be in the post-anesthetic care unit for about an hour. They'll let the doctor will let your family know that everything went well. And sometimes you need to have pain medications, but other times you won't need to have anything in the post-anesthetic care unit. So then you'll go up to the orthopedic floor. You'll get acquainted to your room, they'll check your vital signs, and they'll be checking your circulation. So they'll be, what toe is this? Do you have any numbness or tingling? And it's really important that if you notice any change in the condition that you let your nurse know. They'll be looking at your surgery site, they'll be helping to manage your pain and expedite your recovery. So this is the pain scale that we now use in the hospital, and you'll be shown this when you're in the hospital, and it has some verbiage to go along with the numbers that we used to use. So you've already seen the video of what they do. It is going to be that you will have some pain after surgery. For a hip replacement, it's usually just mild pain, and it can be controlled on just the Tylenol. Again, we'll give you a prescription when you go home. For the knee replacement, you can have pain for up to 3 weeks. We will give you a prescription for the medication of narcotics that will help with the pain. And the pain that the narcotics help with is going to be the bone pain and the surgical incision. The incision will heal, the bone pain will get less, but you may have some muscular pain that you will get from doing your physical therapy, or not doing enough physical therapy, or not getting up and moving enough. And the narcotics really don't help with that. So your doctor will be able to give you the medication to help you through that acute phase. But after that, you probably won't need any medications to help with that pain. So with the mild pain, we're going to give you some medications like Tylenol and Celebrex to help you prevent the pain if you're not allergic to Celebrex. And then we're going to give you the narcotic prescription just to treat the moderate and the severe pain. So what they classify as moderate to severe is usually around 4 to 6. Distracts me, but I can do usual activities. So you may or may not need to take any pain medication then. This one, 6, hard to ignore, avoids usual activities. So if you're in so much pain that you can't get up and move, it's probably time that you need to take some medication, because even the act of getting up and moving is going to help you. It creates a lubricant around your joints, and it's going to make the pain just that little bit better by just getting up and moving as well. And then here we have 7, focus of attention, prevents you do daily activities, can't bear the pain, unable to do anything else. Before it gets to this severe stage, you should probably take one of the medications that they give you. It's usually one tablet of the pain pill. And then when you get up to severe, you might need to take 2. You will get all the instructions while you're in the hospital. You'll have a prescription that you need to follow from your doctor, and any refills you would get from your doctor's office. But this is just really a good way of looking at when you need to give the pain medications. We want you to establish a comfort goal, a number that you could kind of like tolerate. So for me, interrupt some activities, hard to ignore. So definitely before I get to a 6, I would need to be taking some medication, because I want to be a good patient and I want to get up and I want to move around and do what I'm supposed to do, and not just lay in bed all day. So you think there, 1 to 10, what would be the number that you can tolerate? So we want to help manage your pain so that you can move with less difficulty, you can get in and out of bed, participate in therapy, and sleep soundly. You never take a pain pill to help you sleep. You take the pain pill to help manage your pain, which in turn will help you sleep. Getting a good night's sleep is also important to your recovery. And then participating in therapy. For the first 2 weeks, particularly after a knee replacement, you may need to take some medication before you go to your PT appointment, just to get the most out of your therapy. Anything beyond that, that's really a discussion that you would want to have with your doctor and the physical therapy. As I said, the pain medication really kind of helps with the whole bone pain. The muscular pain, the narcotics, it's not necessary to take anything for that after that 2 to 3 week period. So the other really good tool that you will have to help manage your pain is ice packs. So we provide these ice packs for you while you're in the hospital. Everyone will go home with 4 ice packs. 2 will be in the freezer, and 2 will be in your ice wrap. So this are the ice gel packs. They have 6 little packets in there that stay colder a little bit longer, and then there's some gel that will mold. Obviously, they need to be in the freezer for 4 hours to maximum freeze. Then when you bring them out, they're going to be really hard, so you can pop them over your arm and to help mold them a little bit. I'll also provide the link to the manufacturer's video of how to put them on as well. So then I have 2 more in here. These only last about 3 hours. So after the 3rd hour, while you're waiting for the others to refreeze to their maximum, then you can take the ice packs off completely. But let's show you about administration of the ice packs. So you just slip these in here. This is silver impregnated, so it has antibacterial properties as well. It'll go straight over the dressing. This is a knee wrap. And this Velcro is really good. And so what I recommend is that you Make sure that the Velcro is over itself and it's not just free. And then, of course, you may not be able to lift your leg like that, but have family members help you. Pull that tight and pull it tight. And so that's going to provide some relief for pain. This is a continuous cold therapy wrap. You can use this continually. It's not on for 20 minutes, off for 20 minutes. Continuous cold therapy. You can use it for the whole 3 hours, or you can take it off whenever you want to. But it really helps with the inflammatory pain that's occurring after with the wound. And then when you take off the wrap, you want to make sure that you put the Velcros on itself so that when it comes off, it doesn't get stuck to your clothes or your leg. And again, you just put your hand here and do that. And then it'll be all ready to put back on. So when you change it, you'll take these out. You'll put them in the freezer side by side so that they freeze to their maximum. And then during that 1 hour, when you're waiting for the ice packs to refreeze, it's possible that you would elevate your leg higher than your heart. So you would lay on your bed and lay flat. And that's something that we will show you while you're in the hospital. But a few of the tools to help with managing pain is going to be the ice pack, doing some elevation, and then changing position. When you walk, your body naturally produces some lubricant that is going to help with the pain management. So motion creates lotion, which helps with the pain. So they're going to be the tools that are going to help you. You want to get up and move every hour. When you're in the hospital, you might get out for breakfast, 7 o'clock in the morning, and then all of a sudden it's 10 o'clock and you're still sitting there. You want to make sure that you don't sit for long periods. So you can call for the nurse. When you're at home, you want to set your alarm, get up every hour and move around. It really, really does help to manage your pain. I'm going to give you a handout in the hospital that'll have a lot of this information in it as well. And you don't wait till the pain gets too bad. Like I explained, you don't want to wait till it gets to a 10, but you don't want to take it too soon either. And when you're in the hospital, it is your responsibility to call for the medications. So when you go home, I'm going to give you a handout that looks like this, and on the top left-hand corner, it talks about pain management, because we want you to have all the tools that you need to help to manage your pain after surgery. I'm going to say it again. The hip often doesn't have any pain after surgery, but the knee can be quite painful for like 2 to 3 weeks afterwards. The second night is usually the most pain. You'll be at home then, and so that's why it's really good to have this information so that you can review it with your caregiver and work out what you can do to kind of help manage your pain. We talk about your activity, incentive spirometer, which I'll talk to you in a little bit about. You'll have home exercise program. We'll talk about physical therapy. Most people are going to go to outpatient physical therapy. Talk about your dressing. We'll make your post-op appointment, and then these will be the medications that you go at home. Everyone will be on one blood thinner. And so you would only pick one of these. Most people are going to be on aspirin 325. That obviously can change depending on your medical condition. And we'll discuss that while you're in the hospital. Just patients having knee surgery will get the Celebrex, and then everyone will go home on Tylenol unless you have some kind of allergy or liver problems. You'll take that 3 times a day. And then you only take the oxycodone, the pain medication, for moderate to severe pain. Again, you know you're going to have this surgery, you are going to have a little bit of pain, and you'll take that medication for moderate and severe pain. And then opioid-induced constipation is a big thing, so we have patients go home on Colace and Senna. This is our recommendation. If there's something different that works for you, then that would be okay. But it can't be any herbal, okay, sorry. What's the word? I was on such a roll there, wasn't I? Yeah, herbal supplements, yeah. Okay, so will I just start?
Just start with, it can't be any herbal supplements.
Yeah, so you can't take any herbal supplements because again, they may have some blood thinning properties. So talk to us about what you might want to use. So we talk about what the medication is for and what the side effects of the medications are. You won't be on all of these medications. This is just a general list, and then I'll personalize that for you. There are usually 4 over-the-counter medications that you'll be going on. So there'll be the aspirin, 325, the Tylenol 500 milligram tablets, the Colaze and Senna. They're all over the counter, and it's good to get them before surgery if you can. And then your caregiver just has to get the pain medication for you when you go home. So this is the list here. As the blood thinner, the aspirin, or sometimes an injection or some other medication, the Tylenol, 2 tablets 3 times a day, the pain medication, and preventing the constipation. So then my numbers on the front here. On the back, this is a stoplight that we use to give you an idea of when you should call the doctor. So at the top every day it says no Motrin, ibuprofen, Aleve, Advil, or anything like that. You don't want to take another blood thinner with your aspirin while you're on that for the 30 days. This is the green is all the good area. Yellow, you should call either myself, home health, or the doctor, and the red is when you need to go to the emergency room or call 911. So that would be severe shortness of breath or chest pain. That is when you could have a pulmonary embolus. So that would mean that you had a blood clot, typically in your leg, and then that would travel up to your lungs. Pulmonary embolus, blood clot, in your lungs, and these are the signs, and that's the one time that you need to go straight to the emergency room. If you have other issues with your wound or something, it's always good to call your surgeon because they like to know about that before you go to the emergency room. So we do this thing called early mobilization. It means you get out of bed and you walk for a few feet, preferably within 4 hours of coming up to the orthopedic floor. We definitely want you to get up and walk before midnight, but the earlier you get up and walk, the better your outcome and less likely to get a complication, because it's really going to decrease the amount of pain that you have. It's going to really improve your function. It will prevent you from getting that blood clot that may then go to your lungs, and it also prevents you from getting pneumonia. So instead of like laying in bed all crunched over, you're getting up and walking and expanding your lungs. And then it also helps with urinary retention if that does become an issue. So again, the goal is to get up within about 4 hours of coming to the floor. You will work with the nurse. They will have a walker, and then they'll get you up. And it doesn't really matter how far you walk, it's just the fact that you get up and walk maybe 10 feet and then back to the bed. So just looking at some of the complications, some of the physical discomfort, we're going to give you medication to help prevent nausea. We talked about opioid-induced constipation, so we're going to give our recommendation of Senna and Colaze. And then if you haven't gone within like 5 days, we might get you to have some milk of magnesium. After the surgery, your gastrointestinal tract went to sleep too, so you just want to take it light that first evening after your surgery. And then to prevent infection, you're going to do the 3 showers before surgery. You get the antibiotics while you're in the hospital. You'll get 2 after surgery, but you will not go home on any antibiotics. And then you'll have that specialized dressing on that is usually on for about 5 to 10 days. And then to prevent pneumonia, we're going to brush our teeth 4 times a day. You're going to get up and out of bed early, a few hours after surgery, and then also you want to get up and move around a lot when you go home as well, usually every hour. And then this is the incentive spirometer. People always get a little bit confused, but if you just think of yourself drinking a thick milkshake using a straw. So you're going to suck in really slowly. You want to get the the ball here to the 2 arrows, and then you want to keep it and hold it up as long as you can. And I'm actually really not very good. People usually get up to here, or maybe the machine is broken. So you breathe out and then suck in. And hold it. That's 1. And you want to do that 10 times an hour, every hour while you're awake. It might seem excessive, but it will really help to prevent pneumonia and increase your oxygen saturation, which then will help with your wound healing. And then to prevent blood clots, you're going to get up and move early. You're going to walk every hour when you're at home. Just get up. Remember, you don't have to walk very far. Get up, walk to the tap, get a drink of water, come back and sit down. You're going to wear those scuds while you're in the hospital. And then one of the things, foot pumps, just backwards and forwards, pumping your foot like this. And that will really help pump, because you can tell when you're walking around that your calf muscle helps to push the blood from those small veins in your calf, in your legs, up around your body. And so by getting up and moving, you're not letting stagnant blood sit there that could help to form a blood clot. Okay, so for the knee replacement, in bold, the hardest thing to do is to be able to fully straighten your knee. So one of the things that we do when you're in the hospital is that you will want to have the bottom of the bed locked. You will not have a pillow under your knee. And when you're in the bed, you want to have something under your ankle, a rolled up towel or a pillow you can put under the ankle while you're in the hospital or while you're in bed, and that will kind of help straighten. But once you do that, you'll realize your calf muscle is there and your thigh muscle, and so it is really hard to get your legs straight. So another suggestion is to put your foot up on a chair, which will help to really straighten it. Or I say it's the only time it's politically correct to put your foot on the coffee table. So you could put your foot on the coffee table while you're sitting, and that will really help to straighten the knee out. You can work with the physical therapy and your home exercise program on the bending of the knee, and you'll get beyond 90 degrees. But really the hardest thing that people kind of forget about is the fact that straightening your knee is so important. So with the hip replacement for anterior hips, if that's what you're going to be having, you want to make sure that you're not turning your leg out. You're not taking big steps. One of the things is not taking a big step out, because you can feel that there's just a lot of tension on that side. But after surgery, no one's really going to be walking like that anyhow. So just take your regular steps. And if you're laying down and you notice that your leg turns out, then you can just move it in. And then in the booklet, everyone should have a booklet like this, and it has all these precautions in it. We mainly focus on what not to do in here, but this handout that you'll get in the hospital also talks about what to do with the hospital. And then if you're having a posterior hip, it's kind of the opposite. You don't want to do anything that turns your leg in like this. So you don't want to cross your legs, you don't want to put your leg up. You feel a lot of tension in the back area, and definitely like no leaning forward to, like this lady here, no leaning forward, because right here, you know, your incision, and you could dislocate your hip. So here are the things that you can and cannot do. You'll get that brochure while you're in the hospital. So everyone's going to have physical therapy, usually twice a day in the hospital. Maybe you get 1 or 2 sessions in total. Most people are going to go home within 24 hours of having their surgery, sometimes a little bit longer, but most of the time people are going to go home the day after their surgery. So physical therapy is going to help with the functional goals, moving in and out of bed, sitting and standing, walking, climbing the stairs. The exercises that they will give you will really help with the swelling, the stiffness, and it'll really help to decrease the amount of pain that you have. Remember, motion is lotion. They'll give you range of motion exercises and strengthening exercises. And most times we're going to outpatient physical therapy, and for the knee, usually 3 times a week, for a hip, twice a week. So you'll see the occupational therapist. They help with activities of daily living, and they'll give you any adaptive devices that you might need, particularly if you're having the posterior hip because you don't want to lean forward. They might give you the sock, the apparatus that helps you to put socks on. You might need a reacher or some shower tools. And usually you just see them once while you're in the hospital. So again, everyone will go home after day 1. We come as a team to do what we call multidisciplinary rounds around 8 o'clock the day after your surgery. Case manager, PA, myself, your nurse, physical therapy, and occupational therapist. And we'll talk about what you need for your discharge. So getting everything prepared before surgery, but if you have any questions, that will be the time to address them, and we'll make sure that we're all on the same page of what you do need. And then we have planned discharge times of 11, 1, or 2, so whatever time kind of suits your family, you can just let the nurse know, and we'll plan to get you home at that particular time. If you live out of town, I definitely recommend that you try to get your prescriptions filled in town before your discharge from hospital. Your family members can take the prescription to the pharmacy. Just with so many state laws, it's just good to get those filled beforehand. So then after, if you do get home health, which we're tending not to do that often anymore, but if you do, you'll get physical therapy, occupational therapy, and maybe a nurse if that's needed. But most people are really going to the outpatient therapy. It's good to get out of the house. But we'll do that on a case-by-case basis when I talk to you on the phone and then when you're in the hospital. And you'll get a list of all the medications that you need that were prescribed by your doctor to go home. And if you need a refill for your prescription, you'll definitely need to contact your doctor, the doctor's office, and that takes about 1 to 2 days, so definitely contact them in advance. I recommend that you count how many pills, write down how many pills you take each day, how many you use, and then check with the quantity on the bottle to see how long they will last and when you're going to run out. You won't get a prescription filled on Friday afternoon, Saturday, or Sunday, so you want to kind of plan accordingly. And again, most of the time this is going to be for a knee replacement because patients with knee replacement do tend to just need to take a few more pain medicines than if you're having your hip replaced. If you're having a side effect of the medication, please don't hesitate to contact your doctor's office. If you're vomiting, contact them. If you've got itching, or if you have any questions, you can call myself. But if you need a prescription, you would need to call your doctor's office. So we talked about the dressing, what you need to do with the dressing. And again, when you're in the hospital, I will help with any questions that you have about that. And then checking for signs of infection. If you notice any signs of infection, you have a fever, you have any drainage, that it's becoming more painful, or if you see pus, you definitely need to let your doctor know. It is normal to have a very slight fever about 3 days after surgery. It's just an immunological process that happens. And so if you get a small fever at 4 o'clock in the morning, you could wait until 8 to call your doctor if it's in those first few days. Down the line, if it's a week or 2, you should definitely call your doctor and let them know that you do have a fever. So to prevent the blood clots, we've talked about this a lot, but it's just so important for your participation in preventing the blood clot. You're going to take your blood thinner that we prescribe for you, usually the aspirin. You're going to do foot pumps, and then don't sit for long periods of time. Now, how would I know if I had a blood clot? You might have swelling in your leg, but you also might just have swelling in your leg. Obviously, if you have swelling in your non-surgery leg, you should call the doctor. If you're concerned that you have too much swelling, or if you have pain in your calf muscle, you would let the doctor know. They would do an ultrasound, and they would be able to see if you had a blood clot. And then they would not be able to treat that blood clot, but they would prevent new ones from happening. But again, if you get severe shortness of breath, you need to go to the emergency room right away. Severe shortness of breath or chest pain, call 911. So this is our last slide, and I just want to talk to you about, again, being in the best possible health for your surgery, because it'll really prevent complications. Try to reduce the anxiety. Easier for me to say that standing here than you. But if you have any questions or you want to talk about something, feel free to give me a call. Stay well hydrated, get your house organized and prepare your house, and then get those over-the-counter medications. Our goal is to get you back to the activities and lifestyle that you're used to as quickly, but also as safely as possible. We want to get you back to your goals, which may be hiking, biking, or even just walking without pain. So again, if you have any questions, please don't hesitate to reach out to me or your surgeon's office. And congratulations, you will be getting a new hip or knee. And again, let me know if you have any questions.